I welcome you to the Healthy Heart, Healthy Life Pune, session 18D. I'm Dr. Neelkant Karandikar, senior cardiologist from Pune, and I'm going to continue today the discussion about various facets of hypertension. I'm tempted to again tell you about the worldwide prevalence of hypertension and the fact that it is increasing. If you look at this bar diagram where the uh, incidence and prevalence in India is shown, you will see that in 2005, as compared to 2005, in 2025, it has grown significantly. Now, today, the important topic of discussion is the types of hypertension we come across. Oh, beautiful picture of this baby. Now, why I'm showing this picture is to show the various moods of this baby. Just like this baby has shown different moods in these different pictures, even hypertension or high blood pressure has different moods, and it is not at all a static thing, the blood pressure. Sometimes less, sometimes more, but in most of the cases, it is within the normal range, as we will see. Or if it is elevated, it is in the elevated range, though in that range it can go a little up and down. But there are two other interesting phases of hypertension which we are going to talk about today. And these are white coat hypertension and masked hypertension. I've already told you that majority of people have normal blood pressure, and those who have elevated blood pressure, many of them have sustained hypertension. That means whenever you check the blood pressure, it is raised, unless treated, of course. But these two additional types of white coat hypertension and masked hypertension are very, very interesting indeed, something that we must know about. When are you very happy in life? Of course, if you hear some good news, but if your blood pressure is normal, less than 140/90, as far as the European standards, and less than 130/80, as far as the American standards go. By the way, in India, according to our Indian definition, we follow the one less than 130/80. So if your blood pressure is less than this value, then you have every reason to be happy. These two are appearing concerned or worried. Why are they worried? Because their blood pressure might be raised more than 140/90, as we discussed European standards, but we are following the American standards. Less than more than 130/80 is called high blood pressure. Now, what is white coat hypertension is something that is the first thing I want to discuss about. White coat hypertension is a condition or a syndrome whereby a patient's feeling of anxiety in a medical environment results in an abnormally high reading when their blood pressure is measured. This boy is obviously very tense and anxious, and his blood pressure is showing very high value. And that is what is called as white coat hypertension. Your blood pressure rises when you go to a doctor's clinic, and the doctor, who is wearing a white coat, looking very serious, measures your blood pressure, and it comes out to be high. But suppose then you go home and one of your relatives is a medical student or maybe a young doctor whom you know very well, and you are relaxed in the presence of that person, and that person measures your blood pressure at home, and it turns out to be normal. So that is what is white coat hypertension. And this is very important to detect, because those who have white coat hypertension will also develop certain complications of high blood pressure, though their blood pressure comes down when they go home. So these people also need to be monitored, their blood pressure needs to be monitored. Now, what is masked hypertension? Very, very interesting entity indeed. Masked hypertension, this phenomenon of masked hypertension is defined as a condition in which a patient's clinic BP level is normal less than 140 by 90, or according to the present standards, less than 130 by 80. But ambulatory or home BP readings are in the hypertensive range. Suppose the doctor is very well known to you, the doctor is very kind, you like that doctor, and he checks your blood pressure and it turns out to be normal. The doctor smiles and you also smile, and that is a very good thing, that your blood pressure in the doctor's office is normal. But for some reason, you have some nagging person at home and your blood pressure is checked at home and it turns out to be high. Sometimes it may not be high at home, but if you go to your office where you have a nagging boss or irritating person on the desk, sitting on the desk beside you, or for some other reason, the blood pressure comes out to be high, then again it is termed as a masked hypertension. Normal in the doctor's office, but raised either at home or in some other situation. So let us see another picture about white coat hypertension versus marked hypertension. Here is a person who has gone to the doctor and see his blood pressure is coming 175 by 110. The doctor also has a frown on his face and the patient is obviously very scared. But how the white coat hypertension is different from masked hypertension? In masked hypertension, you see this smiling doctor, and when he measures the blood pressure of the person or the patient, it comes out to be normal. But as I discussed some time back, when that person goes home and his blood pressure is measured, it may come out to be high. Or if maybe at home normal, but in the office or somewhere else, it may be high. That is masked hypertension. Another picture showing the comparison between white coat and masked hypertension. In white coat hypertension, the blood pressure is elevated at the doctor's office, 165 by 92, elevated BP at doctor's office, but normal BP at home. And what is masked hypertension? Normal BP at the doctor's office. It may be normal or raised at home, or it may be elevated at home. If it is normal at home, it may be elevated at some other place like your office. But it can be elevated at home also. Even masked hypertension is a risky situation. And the person who has masked hypertension is likely to develop complications of hypertension or high blood pressure. Look at this data. 55% and 52% in two different ways of checking blood pressure, home BP and ambulatory BP, they have normotension, normal blood pressure. 20% in this chart and 15% in this chart have sustained hypertension. That means blood pressure is elevated whether you check it in the doctor's office or whether you check it at home. Normotension, both at the doctor's office and both at home, blood pressure is normal. Here, in both situations, blood pressure is elevated. But what is white coat hypertension? 22 and 18%. Blood pressure is raised in the doctor's office or clinic, but at home it is normal. And last but not the least, the masked hypertension, very dangerous type of hypertension. Here it is shown as 11% and 8% of cases. And here the blood pressure is normal at the doctor's office, but raised at home, or maybe normal at home, but raised elsewhere. Now, That means if you have gone to the doctor's office, your BP is normal, you could have masked hypertension. If you're suffering from headaches, leg cramps, or if your ECG is abnormal or other tests are abnormal, then you have to do certain checkups to detect this masked hypertension. So also to detect somebody and diagnose somebody as white coat hypertension, certain tests like ambulatory BP monitoring, as it is called, and we'll be discussing that next time. And that is essential to detect these two types of hypertension. Whether you have normal tension, sustained hypertension, white coat hypertension, or masked hypertension, will finally be decided on that ambulatory BP monitoring, which we will be discussing next time. So thank you very much. And today we have discussed that, like the moods of that baby, high blood pressure can have different moods and it can be of different types. If it is normal all the time, easy to detect and diagnose. If it is elevated all the time, easy to detect and diagnose. But if it is white coat hypertension or masked hypertension, you need special tests like ambulatory BP monitoring, etc., to detect it. We are going to discuss about that next time, and I'm sure you will attend my next session also. If you have subscribed to my channel, I'm very happy. Otherwise, please do subscribe, give me a thumbs up so that I feel encouraged to bring more and more good information to you. And finally, again, thank you very much and see you next time.